Denise, you got an opportunity to catch up with MSD, so tell us what's going on.
So with MSD, this segment was very interesting to me. Is talking about how MSD does what they call the bio-monitoring program system, but it's so crucial to us. But let's just take a look. So we're here for another topic with MSD because MSD provides our safe, clean waterways. This week's topic is really interesting. I'm here at the MSD Morris Foreman Water Quality Treatment Center, and I'm with Strategic Initiatives and Project Delegation Director Zonetta English and the Deputy Chief of Operations Damon Talley, and we're going to talk about the wastewater surveillance program. And I want to welcome you all both to Urban Lifestylez.
Thank you.
So this is so interesting to me, and Zonetta, I'm going to start off with you. Please tell me about MSD's wastewater surveillance program.
Yes, ma'am. We have a program which involves wastewater epidemiology. So we're looking at really just what the waste of humans and really looking at it from identify biologically and also chemically what we found to improve public health. We have 3 partners. We work with the University of Louisville. We also work with Bioanalytics, which is out of Massachusetts, and they work with MIT. And then we also work with Wastewater Scan, which is in California, who partners with Stanford and Emory University. So we are actually sending our samples there, and then they actually analyze to identify emerging threats that affect public health.
So these threats to public health, are they primarily just specific diseases, or what does it entail?
Well, we're looking at things that every day, like in the past is COVID-19, and right now we're even looking at measles. So most of these organizations are identified like maybe 50 pathogens. So we're talking about what affects in terms of measles for babies, RSV, flu. So really this program is just like an early warning system to be able to tell you ahead of time to the public what's in the wastewater. And so this is just really a perfect system that identifies so that we can inform the public about what's out there so that you can make some informed decisions about where you go and who you're exposed to, because we all have family members and children and grandchildren that their health can be compromised, and then we just want to make sure that our employees as well stay healthy in terms of that. So we're very intentional about making sure that we're involved in these programs so that's just one of our core missions is public health.
Well, I know that MSD provides our safe, clean waterways for our community, and I am just really astounded about hearing about this. When did this type of program start?
Well, we actually started with the University of Louisville. We started that in 2019. And then we started in 2020 with Bioanalytics. They were the first company to be able to identify COVID in the wastewater. And then we started in 2021 with Wastewater Scan, and that's a privately funded a program that impacts probably 150 utilities across the country. So we really can actually look at the data and track it almost every single day to see what is going on.
Zonetta, this is really, really fascinating to me. So how's this data used?
Yes, ma'am. We're using this data by also is being shared with our local and state public health officials as well as on nationally. So we're actually sharing it with CDC, and they have a national wastewater surveillance program. We also this information is used even with vendors who create vaccines. So all of this is just really great research that has been used nationwide, and again, all of this is designed to protect public health.
Is it fair to ask the specificity of, let's say in our community, are there certain pockets within communities where you see more of uptick versus others?
And that's the importance of doing it on a regular basis, because when we have seasonal, like flu, then we can be able to inform the public. They also did this during COVID, is when we were seeing increased cases, then the health department was focusing in on those areas and asking people to get vaccinated. It made a huge difference.
So Damon, how does MSD collect and send the wastewater to program partners?
Okay, so when you mentioned earlier Safe Clean Waterways that MSD does, part of our job, anyways, we already have the infrastructure in place. So to do Safe Clean Waterways, we're sampling. As you see here, we sample at our water quality treatment centers daily. We also sample out in the collection system. So once U of L approached us and the other partners approached us about the opportunity to sample. All it was coordinating where we would like to get those samples. So we worked with the University of Louisville and BioBot to look at our overall, what we call them sewer sheds, of where we would collect these samples. So they would give us some ideal locations they would like, and then with our subject matter experts, we'd go out and investigate those manholes, pump stations, collection systems, and we would determine they wanted to have an encatchment of so many people to be able to have this data to be relevant, as Zonetta explained, in terms of community health. And then we would set up the samplers. So we have a staff in our support services department, in our industrial waste department, that would go out. We would schedule these samples based on, for an example, we've set up composite samplers on Monday. So we would pick a location, we'd set up the sampler on Monday, and we'd pull the samples Tuesdays and Wednesdays. And again, because of their expertise, they knew how to properly store the samples, properly collect the samples, so they wouldn't be contaminated, or there wouldn't be, when you get the data back, the data wouldn't be compromised. And then we would deliver those samples to our partners. That would either be taking them directly to U of L, or we would box them up to mail them off to your offense.
You know, every time you do one of these segments, I learn something else that MSD does, because now they're involved in, helping us stay safe as it relates to airborne diseases, viruses, and different things like that.
Right. So basically, when you look at communities and we look on the news, in a community where you have, like, I'm going to say, an epidemic where things are contagious, like measles outbreak, COVID,
Sure.
as they stated, so forth. So I was saying, well, what about that cyclosporin that people eating, like raw food lettuces, and that's not contagious.
Right.
So that's not on the forefront, but anything that would endanger us as a community, MSD is first part on getting that through to the CDC and so forth, keeping us safe.
Right. Once again, Denise, another great report. We'll take another break, and we'll be right back. And I'm back again with Aretha Fuqua, who is the president of the West Louisville Tennis Club. Aretha, tell people what they can expect if they're going to join the West Louisville Tennis Club.
You can expect to have a lot of fun. You can expect to be involved in fellowship. You can expect to travel. You can expect to get a t-shirt. You can expect to grow, and you can expect to learn how to love each other. And we have newly renovated hard courts. We have 6 of them, and they're absolutely beautiful. We have 6 clay courts that are absolutely free. And if you're down here at the dusk, those lights come on so beautiful. It's like, oh, it's picturesque. You have to see it.
All right, so you've heard it. West Louisville Tennis Club. If you don't have your membership, make sure that you get it now. Go to their website. So every month we catch up with Starks Realty, because whether if you're in the homeowner, buying business, or looking to do something from a retail perspective, you need to get some great information. So here we're going to check in with William Starks at Starks Realty.